So, hello. So, we are going to talk about today in pathology the most important thing, the most vital organ, that is the liver. So, we are going to talk about the liver function tests. So, that's the LFT. So, what are the liver function tests? What is liver function test? So, we are going to talk about this today. That is the liver that is known as the LFT. So what is LFT? What is liver function test? Liver function tests are some biochemical investigations. So basically, we take the blood sample and we do some biochemical investigations to assess the capacity of the liver to perform its functions correctly, whether correctly or not. So we know that the liver is a vital organ and it performs lots of functions. According to its functions, we can divide these tests. Like there are lots of tests in the department of liver function test. Like we can say the first one is the like something like liver have some excretory function. So there is a test for excretory function. Test for excretory function. Then it has some enzymatic functions. We will discuss it elaborately later. That is tests for enzymatic functions. Then we can say that test for it has some synthetic function. Then we can say that it has another thing, that is the detoxification function. Test for detoxification function. And we can say there is some virus, that is, we know there's the hepatitis, that's the viral marker. So we can test also some viral markers. And there is also another thing, that is the tumor marker. And some like immunological test. Lots of people have those immunological disorder associated with liver. There's some immunological test. So these are the tests we include in the liver function test we can do in the blood. These all are the biochemical tests. We take a sample of the blood, then we send it into the laboratory, then we done this biochemical test. So now we'll talk about the first thing, that's the test for excretory function. So we know the most vital important thing, that is the excretion, that is the bile excretion. So in the first one is the excretory function, test for excretory function. That is, we can divide excretion through, one thing is the most important thing is the in serum, that's we know that normal physiology, and that the RBC, it has a heme part, and the heme part that break down and produce the bilirubin, and then it goes into the liver. Here it all excreted through the bile. So the main important thing in the blood or in the serum, that is the uh, bilirubin. So in case to check the excretory function in the blood, we can say in the blood, we can say we're going to assess the serum bilirubin concentration. That is the serum bilirubin concentration. So now the most important thing is what is the normal value of the serum bilirubin concentration. The normal serum bilirubin concentration, if we say, that is in case of milligram per deciliter, that is 0.3 to 1 milligram per deciliter. This is the normal range or normal value in the blood or in the serum bilirubin concentration. But in case of internationally, we can say the unit is into micromole per liter. So in micromole per liter, the normal value of the serum bilirubin concentration is 5 to 17 micromole per liter. So if we see the results is above the 17 micromole per deciliter or 1 milligram per deciliter, there may be some pathological changes in the liver. Okay, so now we can also find in blood. We have said the serum bilirubin concentration. We know that in urine, there is a urinary bilirubin that is known as the urobilinogen. So if the level of urobilinogen is increased or decreased, there may be some pathologies. And now next, in stool, that is known as the stercobilinogen. It also indicates the excretory functions. So in case of the test for excretory function, we see in the blood, that is the serum bilirubin concentration. What is the normal value of serum bilirubin concentration? That is the 0.3 to 1 milligram per deciliter. In case of international unit, that is 5 to 70 micromole per liter. And in case of urine, we can find the urobilinogen. And in stool, that we can find the stercobilinogen. When we will talk about the jaundice, then we will see these markers elevation or depression. So now, second thing that we have discussed, that is the test for enzymatic function. And this is very much important. That is the test for enzymatic function. What is the test for enzymatic function? There is we can divide it into two pathology. Two different type of enzymes can be diagnosed. That is in case of hepatocellular damage. So hepatocellular damage, like lots of inflammation of the hepatic cell, that is the hepatitis. Okay, so in case of hepatitis or hepatocellular damage, or we can say that is the hepatitis. There is two enzyme that we can assess. That is the alanine amino transferase. Or that is known as the ALT. This ALT also known as the HGPT. That is the serum glutamic pyruvate transferase. And what is its normal value? Its normal value, basically, if we say, that is the 10 to 40 unit per liter. This is the international unit per liter, and this is the normal range of ALT or HGPT in case of blood. So we can say in the hepatocellular damage or hepatitis, we can see the enzyme, that is the alanine aminotransferase or HGPT or serum glutamic pyruvate transferase. What is normal value? That is the 10 to 40 unit per liter. Another thing that we can see, that is the AST, aspartate aminotransferase or HGOT, that is the serum glutamic oxaloacetic transferase. What is its normal value? Its normal value is basically, if we see, that is, what is normal value? That we can say, that is the 10 to 35 unit per liter. So these two are basically hepatocellular. In case of hepatocellular damage or hepatitis, we can see these two enzymes. This is the indication of enzymatic function we can see in the blood test or biochemical test. Now there is one kind of thing, that is the biliary obstruction. In case of biliary obstruction, or we can say the obstructive jaundice. In case of obstructive jaundice, we can see another two enzymes. That is the, we can say, that is the alkaline phosphatase, ALP, alkaline phosphatase. What is its normal value? Its normal value, basically, we can say that is that 40 to 125 unit per liter. Another enzyme we can see in case of biliary obstruction or obstructive jaundice, that is gamma glutamine transferase, GGT or gamma GT. What is its normal value? It is slightly different between in case of male and in case of female. So in case of male, what is the normal value? In case of male, we can see that the normal value is 10 to 55 unit per liter, and in case of female, we can see the value is 5 to 35 unit per liter. So this is the test for enzymatic function. Now we will see another thing that we have said, that is the test for synthetic function. We know that they synthesize the protein, the albumin. So test for synthetic function. The first thing that we're gonna see, that is the serum albumin. Serum albumin level. What is the normal value of the serum albumin level? The normal level is basically, normal is 4.8 gram per deciliter. This is the normal rate. What is the range? The range is basically between the 3.5 to 5 gram per deciliter. This is the range. Okay, so this is the range. So if we see a decrease in albumin level, the falling in the albumin level, it indicates the severity of the chronic liver disease. In future, we will talk about it details. Okay. Then we see the second test, that is the albumin globulin ratio. The albumin globulin ratio, and the normal level of the albumin globulin ratio is basically 1.7:1. This is the normal range. And another important thing that we see, there is the prothrombin time. So we will see the prothrombin time, PT. So what is prothrombin time? So prothrombin time, the normal range, basically prothrombin time is 12 to 16 seconds. This is 12 to 16 seconds. It is the most specific and sensitive indicator in case of, we can see, both chronic and acute liver disease. Another thing we can see, that is the serum total protein. So serum total protein concentration, if we see serum total protein concentration, that is basically, normal value is basically 6 to 8 gram per deciliter. Okay. So these are the 4 things we can see, assess in case of test for synthetic function. And also we have said there is a test for detoxification function. Detoxification, that is the serum ammonium concentration. In case of detoxification function, we can see serum ammonia concentration. And another thing that we have said, there is a viral marker. So what is viral marker? Basically, viral marker we can say in the cirrhosis of the liver, CLD patient, cirrhosis of the liver, বা hepatocellular carcinoma. In case of hepatocellular carcinoma, the viral marker, that is alpha fetoprotein. The viral marker is basically alpha fetoprotein. So in case of hepatocellular carcinoma, alpha fetoprotein. In case of hepatocellular carcinoma, HCC. Hepatocellular carcinoma, alpha fetoprotein is the viral marker. And also we have said some, that is the, this is the tumor marker, that is alpha fetoprotein. This is the tumor marker in case of hepatocellular carcinoma. And there is a viral marker that we know, the hepatitis. The viral marker is antiviral titer, we can say, and that is the, in case of lots of the hepatitis A, B, C, D, and E. There is the viral markers.